Okay, let's unpack this. Today, we're diving deep into scoliosis. It's a condition that, well, brings up so many questions, doesn't it? And often a lot of fear, frankly, and, a ton of misinformation, especially when we're talking about kids. So our mission for this deep dive is really to cut through all that noise. We'll explore the sources you shared, pull out the absolute essential insights, and hopefully bring you some real clarity and maybe a lot more peace of mind. Get ready, because I think we're going to challenge some very common ideas about scoliosis here.
That's absolutely right. The concern around scoliosis is, it's very real, completely understandable. So our intention today is to build a solid sort of foundational understanding, offer some practical guidance based on experience in the studies, and really clarify what truly matters. Moving beyond those, often confusing stories you hear.
Understood. Okay, let's start right at the beginning then. Fundamentals. When we think about a healthy spine, it has those natural curves, right? Front to back. But scoliosis, that's different. Can you give us a clear definition? What is scoliosis fundamentally, and how does it really differ from a typical spine?
Certainly. So at its most basic level, scoliosis is a lateral deviation of the spinal column, essentially a side-to-side curve.
Lateral, okay, side to side.
Exactly. And that's distinct from the spine's natural antero-posterior curves, the front-to-back ones you mentioned. You see, our spines, well, like all mammals actually, physiologically need specific forward and backward arcs. There's an inward curve in your neck, cervical lordosis, an outward curve in your upper back dorsal kyphosis, then another inward curve in the lower back lumbar lordosis, and finally an outward curve at the very bottom, the sacrum and coccygeal.
Right, those natural curves we see.
And they aren't just for looks, they're absolutely vital. Because the spinal cord, which is basically an extension of your brain, runs right inside that column. Without those specific front-to-back curves, you'd get immense tension, traction on the brainstem.
Yeah.
Well, it's completely incompatible with life.
Wow. Okay, so those front-to-back curves are absolutely non-negotiable for survival, but a lateral deviation, scoliosis, that sounds like a totally different kind of curve.
Precisely. And what's intriguing is that these lateral deviations, the scoliosis curves, well, at first glance, they shouldn't have any complications because the curves are simply in a different plane, sideways, not front to back. It's often a genetic congenital issue, meaning it's something a person is either born with or genetically predisposed to develop.
Genetic.
And the most common pattern we see is what's called the double compensated configuration. So imagine a curve in your upper back, maybe it goes to the right perhaps to sort of avoid the heart area. And then the body naturally balances that, compensates with an opposite curve in the lower back.
Ah, so the body tries to even things out.
Exactly. We also see C-shaped scoliosis. It's just one single global curve, usually to the right, though sometimes less commonly to the left.
It really sounds like the body is incredibly adaptable, finding its own balance. But let's get into what really keeps people up at night, the anxieties. For someone with scoliosis, or maybe especially for parents of a child diagnosed with it, the fear can be huge. Does scoliosis compromise vital organs, like the heart, the lungs, and crucially, the big one? Does it actually cause pain?
Yes, these are definitely the biggest fears. And it's so important we address them directly, hopefully to bring some tranquility, as you said. What's fascinating here is, well, look, having personally worked with thousands of cases in my practice over the years, I have never once observed cardiac, pulmonary, or renal compression due to the scoliosis itself.
Never, even with severe curves.
Even in patients with more than 100 degrees of deviation in their lumbar spine, for instance. We've done extensive studies, cardiac echoes, pulmonary function tests, renal scans, intestinal checks on these patients, and never, 0 times, as the source material puts it, have we found internal organ compromise that was actually caused by the spinal curvature. That fact alone, I think, should offer a significant sense of calm.
That's incredibly reassuring for a lot of people listening, I imagine. Okay, so if organ compression isn't really the issue we might fear, what about pain? So many people, you hear it all the time, they have back pain, and they immediately point to their scoliosis. Is that truly the source?
That's a really crucial question. And it's where we need to make a strong statement, one that might feel counterintuitive. Scoliosis should never generate pain.
Never. That is counterintuitive, because everyone seems to think it does.
Anyway, it often surprises people, especially given how common the idea is, online, social media, just general conversation, that scoliosis causes back pain. But if we really look at the biomechanics, there's nothing inherent in the middle of that lateral curve itself that should directly generate pain signals. The body, in a way, is genetically programmed for this specific lateral curvature if someone has scoliosis. Often, the pain people experience, well, it might come from other factors, maybe muscular imbalances around the curve or postural habits, or sometimes it's exacerbated by the psychological
That's
impact.
the psychological part.
Yes, being told you have a problem, a condition. Parents, understandably, they often come in a state of absolute panic.
Hmm.
And if you combine that panic with maybe a bad therapeutic decision, something overly restrictive perhaps, well, that can create a really detrimental combination for someone's psycho-emotional well-being.
That makes sense. The fear itself becomes part of the problem.
Precisely. And that's also why I personally would never speak of scoliosis as a disease,
Mhm.
primarily because labeling it like that brutally stigmatizes people, especially children.
Mhm.
It's often simply a structural variation, not a pathology, not a disease in the usual sense.
That's a really important reframing, moving away from disease and the assumption that it's inherently painful. But okay, if it's not causing organ issues, not inherently causing pain, what is happening structurally? Especially when we see those visible changes, like one side of the back looking more prominent. Sometimes people call it a hump. What's behind that?
Ah, yes, the visible changes. That's an excellent observation, and it brings us right to the unique biomechanics of scoliosis. See, it's not just a lateral side-to-side bend. That's only part of the picture.
Mhm.
At the same time, when the column inclines to one side, it rotates to the opposite side.
It rotates too.
Okay. Yes, this rotational component is absolutely key. It's what explains the saliency, or that more elevated appearance you see on one side of the upper back. It's what becomes obvious during the Adams maneuver, when someone bends forward at the waist.
So that hump isn't just muscle, it's the rotated spine.
Exactly. It's the vertebrae themselves rotating along with the sideways curve. It's not just a simple bend or purely muscular development. Now, if we connect this to the bigger picture, the long-term outlook, while scoliosis, because of that asymmetry, always predisposes the spine to asymmetric wear of the vertebrae over a lifetime.
Okay, some uneven wear and tear.
Right. But this doesn't automatically mean immediate problems or pain, not at all.
Yeah.
Significant issues, like pain arising directly from this asymmetric wear, well, they're typically not seen until people reach 50 or more years of age, much later in life.
50 plus. That's much later than people might think.
Exactly. And even then, it often coincides with the general sort of metabolic hormonal osseous muscular collapse, as the source describes it, that can happen around menopause in women or andropause in men.
Hmm.
But even then, it's not an inevitable outcome, not if the condition is managed proactively throughout life.
Right. So the visible changes are mostly rotation, and any significant wear is usually a much later life consideration. Okay, this leads us to treatment. There's so much information out there, so many options: bracing, surgery, different therapies. What treatments should we maybe approach with caution? And crucially, what should we definitely avoid when managing scoliosis?
Yes, this is a critical area. Misconceptions here can really lead to less than ideal outcomes, sometimes even harm.
Mm.
Let's talk about bracing first. For children, say age 12 to 15, the rigid plastic TLSO corset,
TLSO.
thoracolumbocervical orthosis, basically that hard plastic body brace designed to restrict movement. That type of brace usually doesn't work.
It doesn't work.
Well, largely because the condition, as we discussed, is often genetic. The structural pattern is somewhat ingrained. Trying to force it straight with rigid pressure often doesn't change the underlying progression. Now, if such a restrictive corset is considered, maybe for very specific, severe, rapidly progressing cases, the sources suggest it's perhaps a good alternative only at night.
Only at night.
Yes, when the muscles aren't actively working against it, and the person naturally sort of curls up into their comfortable scoliotic position anyway during sleep. For daytime use, if bracing is deemed necessary, dynamic corsets, which allow for some movement, are potentially a better tolerated option. They don't lock the spine down completely. But this whole discussion about restriction raises a really, really vital point. The absolute worst option for scoliosis, or frankly for any spinal issue, is immobility, restriction of movement.
Immobility is the enemy. That's a very strong statement you made earlier. Can you expand on why restricting movement is so detrimental?
It's devastating because locking the spine down, preventing movement, it will atrophy not only the muscles, which is what people might expect, but also ligaments, tendons, everything related to the joints and the synovial capsules that keep them lubricated. Even the aponeurotic tissues, the connective fascia. It can even contribute to calcification and stiffening of arteries, veins, even nerves in the area. Essentially, everything begins to petrify, to stiffen up and lose its natural resilience.
Wow, that sounds incredibly damaging,
Yeah.
far beyond just muscle weakness.
It is. Our bodies, and especially our spines, are fundamentally designed for movement.
Hmm.
Taking that away creates a cascade of negative effects, making the spine much more vulnerable in the long run. It can lead to a host of other problems the scoliosis itself wouldn't necessarily cause.
That's a powerful warning. Okay, so if restriction and immobility are the enemy, then a completely different approach is needed, right? A fundamental shift. What should people with scoliosis be doing then from a movement perspective? This really sounds like it calls for a kind of movement revolution in how we manage this.
Absolutely. A revolution is a good word for it. Movement is, without question, the cornerstone, the absolute foundation of effective scoliosis management. The focus really needs to be on improving what we might call epigenetic issues, things we can influence, like lifestyle habits, to foster a better long-term prognosis.
Okay, so be active. What kind of activity?
For young people, generally most sports that involve some impact are actually fine, often beneficial even. They help build bone density and muscle strength.
Impact is okay, like running, jumping.
Yes, within reason. However, there are a few specific activities where some caution is advised. Things like horse riding, mainly due to the significant risk of falls and direct trauma to the spine. Also, some martial arts with a lot of repetitive falling techniques, like Aikido perhaps. And sports involving excessive jumping combined with high reaching, like competitive volleyball or basketball. The repetitive high-impact loading in specific directions could potentially increase scoliosis, muscular retractions, or even intervertebral wear over time.
Okay, so some nuances there. General activity good, but be mindful of high-risk falls or extreme repetitive loading. What about for adults, especially older individuals who might already have some arthritis, maybe some osteoporosis?
Great question. For older individuals, even those dealing with things like arthrosis or osteoporosis, movement remains crucial. Walking, certainly. Running, if appropriate for the individual. And, importantly, lifting weights.
Lifting weights, even with spinal issues.
Yes, absolutely. We need to strengthen the muscles. We need to strengthen all the peripheral structures that provide support to the spine. You have to remember, the spinal column isn't just a stack of bones. It's embedded in a muscular mass and many tissues. And all of that needs to be active and strong to provide stability. Cardio-aerobic work should definitely be part of the mix, too, for overall health.
Okay, strength training is key. What about swimming? That's always recommended for back issues, isn't it?
Swimming, yes, it gets recommended a lot. But the expert opinion here is that it's possibly overrated. It has too much good theme, perhaps.
Overrated. Interesting. Why?
Well, while it's low impact, it doesn't provide the same kind of weight-bearing stimulus for bone density or the same type of muscle strengthening, especially for the core postural muscles that weightlifting or even just walking can provide. Personally, I'd often favor team activities maybe for the social aspect, the social distension in tribe, as the source puts it, combined with dedicated weightlifting for more effective spinal strengthening. The fundamental principle, really, is that the key is always going to be in the muscles and generating muscular contraction to support the spine.
Got it. So focus on building active functional strength around the spine, not just gentle movement. This is clearly a whole body approach then. It's not just about the spine in isolation. What other lifestyle factors are just as crucial as movement for managing scoliosis healthily? It sounds like we're building a whole supportive ecosystem.
That's exactly the right way to think about it, a supportive ecosystem. And right alongside movement, maybe even foundational to it, is nutrition. We really need to advocate for an optimal, conscious, healthy family diet.
Okay, what does that look like specifically?
It means a serious, determined effort to eliminate common inflammatory foods and toxins, as the source calls them. We're talking about gluten, refined flours, processed sugars, cow's milk, alcohol, and essentially all highly processed foods.
That's quite a list. Why is diet so fundamental here?
Because without addressing this foundational inflammation and providing the right nutrients, any other treatment, exercise, therapy, whatever is like, well, the analogy used is throwing dirt and then removing it with a shovel, or the leaky boat syndrome.
Leaky boat?
Yeah, you're busy bailing water out, doing treatments, but you haven't fixed the leak, the underlying dietary issue. So the problem persists. I can give you a stark example from practice. I have never been able to help a 15-year-old girl who is significantly overweight and has scoliosis without implementing these fundamental dietary changes first. It's that critical.
Wow. That really drives the point home. Diet as the absolute foundation. What else is part of this holistic ecosystem for spinal health beyond movement and diet?
Well, we also need to look at metabolic health more broadly. I'd recommend blood tests to really evaluate the whole metabolic system. Things like hormone levels, thyroid, sex hormones, markers of digestion, mineral status, maybe even heavy metal levels. And if imbalances are found, it's crucial to work on correcting them. Then, beyond the sort of medical checks, we need to utilize all the natural tools we have available. Things like ensuring adequate quality rest, implementing effective stress management techniques, huge impact there, and getting consistent exposure to nature, sunlight, fresh air, all incredibly beneficial.
So sleep, stress, nature, the basics, but often overlooked.
Exactly. And supplements. They can be necessary sometimes, perhaps for specific nutrient deficiencies identified in testing. But this absolutely requires an individualized assessment. You need to consider age, gender, the specific type and severity of the scoliosis, any other health conditions. It really brings us back to that core principle, N1. Every single person is unique and requires a personalized approach to managing their scoliosis effectively. There's no one-size-fits-all recipe.
N1. I like that. It really emphasizes tailoring the approach. Okay, so we have movement, diet, metabolic health, stress, sleep. A very comprehensive picture. Now, if there is a clear component of muscular imbalance or maybe tight soft tissues contributing to discomfort or postural issues, what specific hands-on therapies can complement this whole approach?
Right. Sometimes, despite getting the foundations right, there might still be a persistent disruption in the compensation of muscular chains, or a noticeable disbalance in soft tissues that benefits from direct, hands-on intervention. In these cases, specific therapies can be very valuable. Things like specialized postural retraining methods, RPG, global postural reeducation as mentioned, or the Tres Esquadras method, which focuses on spinal stabilization and posture. It's also important sometimes to consider therapies that address the visceral function, how the organs might be influencing posture and overall biomechanics.
Visceral function, like how the organs relate to the spine.
Yes. Sometimes tension or dysfunction in the organs or their connective tissues can create pulls or restrictions that affect spinal alignment and movement. It's a more subtle connection, but important in a holistic view. Other effective modalities could include osteopathy, chiropractic care, focused on function, not just adjustment, specific types of vertebral praxis, and various myofascial release therapies.
So different hands-on approaches depending on the specific need.
Exactly.
Yeah.
The overall goal of these therapies is essentially working with hands on the body to help optimize the person's function within their entire environment and ecosystem, the ecosystem we've been talking about building through diet, movement, and lifestyle. Ultimately, the decision regarding specific interventions, whether hands-on or even surgical in very rare extreme cases, involves carefully evaluating whether it is necessary or not to try to correct the curve itself, or if it's better to focus on optimizing function and well-being with the curve, accepting it as part of the physical structure of the person.
What an incredible deep dive this has been, really challenging so many long-held beliefs about scoliosis. Just to recap some key takeaways, scoliosis is generally not a disease in the typical sense. It rarely causes significant pain directly, and surprisingly, it doesn't usually compromise vital organs, even with large curves. The real path to managing it well seems to be this holistic, movement-centric approach, far more effective than just restrictive measures like those rigid corsets, which might be overrated, perhaps a bit like swimming in this context, surprisingly. And the power of a conscious diet, focusing on whole foods alongside strength training and looking after your metabolic health. These seem to be the real unsung heroes here.
Absolutely. And perhaps a final thought for you to mull over as you integrate all this. Consider how truly embracing these principles, prioritizing robust, intelligent movement that builds strength, committing to conscious nutrition, achieving metabolic balance, and always demanding a personalized N1 approach. How this can do so much more than just manage scoliosis effectively. It can actually empower a profound improvement in your overall health, your energy, your resilience, your entire well-being. It's really about shifting the focus from fear of a label, fear of a curve, towards proactive, integrated care for your entire body. Recognizing that the human body is this incredibly complex, adaptive system capable of amazing resilience, and you have far more power to influence that positively than you might think.